Hello everybody and welcome to the University of Queensland Faculty of Health and Behavioural Sciences Alumni webinar series. My name is Paul Purcell and today we'll be joined by Associate Professor Neil Cottrell from the Faculty of Health and Behavioural Sciences. Neil is the Director of Interprofessional Education within the faculty and is responsible for strategic oversight of the faculty's portfolio of interprofessional education activities. I begin today by acknowledging the traditional owners and their custodianship of the various different lands on which we all meet today. On behalf of the University, I pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. For those of you joining us live today, you're encouraged to ask questions throughout the webinar. You can do so via the Q&A function, which you'll find at the bottom of your screen, and we'll endeavour to answer these at the conclusion of Neil's presentation. Additionally, this webinar is being recorded and will become accessible via the HaBS Alumni webpage early next week. Everyone who's registered will send out a link to that recording and you'll be able to forward that on to any colleagues who may have missed out. On that page, you'll also be able to check out some of the other great episodes from our Health Alumni webinar series. And now, it gives me great pleasure to introduce Associate Professor Neil Cottrell.
Thank you very much, Paul, and welcome everybody. Thank you for tuning in to listen to this presentation where I'm going to let you know about some of the exciting developments that are going on around the development and implementation of an interprofessional collaborative practice curriculum for the students across the Faculty of Health and Behavioural Sciences. So I guess in starting, I weighed up for a while how I was going to sort of try and pull you in about why we're doing this. And I'd just like you to have a look at the following picture and think about what you see immediately. So I would imagine probably about half of you are looking at that and saying, okay, that's a rabbit. What you may not realise is probably the remainder of the people are looking at it and going, that's a duck. And now both of you will, with those views, will be looking at this and going, oh yeah, it is a rabbit, or yeah, it could be a duck. So clearly we brought different perspectives about how we look at something. For those of you like myself who are Marvel or DC comic fans, here's perhaps a more modern interpretation of that. So the first time I looked at this, I saw two Batmen. So there we are, we have two Batmen standing face to face. Others of you may look at that and go, well, hang on, when I look at that as a whole, that's actually Wolverine. So why is Neil presenting this to us? Well, if you think of either of these being a client whom we're looking after, already we may have looked through our own professional lens when talking and interacting with that client. And clearly we will see different things than our colleagues from other professions. But it's only when we come together and start to collaborate along with the client that we really start to build the whole picture about what's going on. And of course, that's why teamwork and collaborative practice are so important in healthcare. So let's look at what interprofessional collaborative practice is. So as a definition, the World Health Organization says this is when multiple health workers from different professional backgrounds provide comprehensive services by working with patients, their families, carers and communities to deliver the highest quality of care across settings. And if we think about where that fits in team functioning and communication within healthcare, this is where it really becomes important in relation to client and patient outcomes. So we know if we have effective teamwork in healthcare, we reduce medical errors and we increase patient safety. And unfortunately, where sentinel events have occurred, when root cause analysis has been applied, we know that system errors often lead back to a lack of team functioning or poor communication arising. We also know that effective teamwork reduces readmission rates for clients. Often what's overlooked though is that when you're a worker in an effective team, your stress at work is markedly reduced and you're far more likely to stay in that role, and you're going to be a lot more satisfied with your job or role. And if we reflect ourselves about times when we've worked in effective teams, we know what a pleasure those times have been. And if you're unfortunate enough to have worked in a team where it's not really been an effective team, you also know that that was a stressful time, and certainly you probably didn't enjoy your job or role as much. So I've shown you briefly some of the evidence for teamwork. What about interprofessional collaborative practice within teams? Well, yeah, again, the evidence is there to support collaborative practice, improving access to health services, improving appropriate use of specialist services, and improving health outcomes, particularly for people with chronic diseases. And if you look on the right-hand side of the slide here, you can also see again that collaborative practice decreases patient complications, length of hospital stay, tension and conflict among caregivers, which again reduces staff turnover. Hospital admissions, clinical error rates, and mortality rates have also been shown to be reduced. So there is evidence there that collaborative practice achieves the outcomes we're looking for our clients. The World Health Organization identified the relationship between health and education systems and how they integrate to improve health outcomes through creating collaborative practice ready health workforce, so that we deliver collaborative practice and within a local context, we strengthen the health system and improve health outcomes. And clearly that also scales up to improving health outcomes in the broader context as well. And this also identifies where interprofessional education comes in, both in terms of interprofessional education in the present workforce, but also interprofessional education for the future health workforce, so that we're collaborative practice ready. So that may get you thinking, well, what is interprofessional education? What does that look like? And I think this is the definition that is most commonly put about, and the key words in here are from, with, and about. And interprofessional education occurs when students from two or more professions learn about, from, and with each other to enable effective collaboration and improve health and social outcomes. And clearly I have students from in there, because this is what we're doing, or the framework we're using to develop our interprofessional collaborative practice curriculum. But you can imagine if you remove that, then it equally implies in practice when it occurs when two or more professions learn about, from, and with each other. And this is important, the with, from, and about, because if we had people in a classroom or a lecture theatre learning about a particular topic alongside each other, but no interaction going on, no learning with, from, and about each other, that is not interprofessional education. That is more multi-professional education, where we're learning about the same thing, but learning alongside each other. And in the Australian context, this is becoming more important. From my perspective as an educator, more of the accreditation standards are looking for courses and programs, particularly to demonstrate where interprofessional education and opportunities for interprofessional learning to allow students to develop skills, knowledge, and attitudes for collaborative practice are embedded. And also at a policy level, which is why I've included this paper from Jill Thistlethwaite and Roger Dunstan, where they've identified how within workforce planning new healthcare models need interprofessional education to support the development of collaborative practice. So that leads us on to think about our interprofessional collaborative practice curriculum. And if you think with one of the challenges we have is that we are very good at educating our disciplines within their discipline silos and then expecting them to go out into a workforce where they could be working in teams of different health professionals and expecting to have the skills that allows them to collaborate. And I think this diagram or cartoon illustrates that quite nicely of how can they learn together, how can they work together if they don't actually learn together. And that's what our strategy is all about. I was appointed into my role as the Director for Interprofessional Education within the HaBS faculty back in 2019 to take forward an interprofessional education strategy around teaching, research and engagement. And I'm going to spend the rest of this presentation focusing on that teaching and where we are in the development of this interprofessional education strategy within a teaching context. So when I was appointed around about the beginning of 2019, in March, the first thing I did was to put together an interprofessional education curriculum committee. And this contains representatives from the 14 disciplines within the faculty. It has representatives from the Faculty of Medicine and representatives from the student body. And this committee is involved and actively engaged in designing our curriculum. And I have to say, this committee works very much along the lines of modelling interprofessional collaborative practice in the way that it works, both in terms of the way communication happens, the way people understand the different roles that people have within the committee. And I think as well the element of collaborative leadership, although I chair the committee, there are different facets where people take a leading role. The other thing that we have happening in parallel is an interprofessional education facilitator training committee, where we have representatives from the school within the faculty, so from the 6 schools, designing facilitator training for our tutors who will be involved in facilitating the curriculum and the students within the curriculum. And clearly, if we're designing interprofessional education learning activities, it's important that we have facilitators of those activities who are trained to facilitate groups of students from different disciplines, where there are different challenges than just facilitating students from your own discipline. One of the first things we did was decide what was it we were going to scaffold our curriculum against. What was the competency framework we were going to use as our scaffold? Now, there are a number of competency frameworks from America, Canada, and the United Kingdom, and there are a couple within Australia. We decided, though, we were going to adopt the National Interprofessional Competency Framework from the Canadian Interprofessional Health Collaborative. And there are a few reasons for that. The first was this framework has been embedded and used both within undergraduate education, but also within practice education as well. And there was a lot of experience of using it within both of those contexts. We have good collaborations with the University of Toronto Centre for Interprofessional Education, and they were very generous in sharing their curriculum development against this competency framework. And finally, what we particularly liked about this competency framework compared with the others, they were very explicit about competencies for interprofessional conflict resolution and collaborative leadership. And we felt these were important competencies for our students to be aware of and for them to start to develop some of the knowledge and skills they would need to help manage help manage conflict, but also develop collaborative leadership skills. So this is what the pictorial representation we have of our collaborative practice curriculum. So we have collaborative practice, and we are have developed learning outcomes around role clarification, team functioning, interprofessional communication, client-centered care, interprofessional conflict management, and collaborative leadership. And this is what our learning outcomes look like. I don't for a minute expect you to read all of these. This is here really to demonstrate that for all of the competencies, we have developed learning outcomes, 11 in total, that are scaffolded against each of these competency domains. And also you'll notice across the top of this table, we have what we call phases of learning. So we have exposure phases where the students are exposed to new knowledge within these learning outcomes. Immersion phase where the students start to apply this knowledge, and then competence phases where the students actually demonstrate the application of their knowledge and skills in a variety of different contexts. And if we break this down a bit further, so I've picked interprofessional communication as an example, you see that we have our program level learning outcome, but what we've done is that we've broken down what we would expect a student to be able to demonstrate or acquire. So if we look at an exposure level, we would expect a student to recognise and define effective interprofessional communication in healthcare. If we move into an immersion phase of learning, we would expect students to be discussing barriers and enablers to effective interprofessional communication. And then if we look at the final thing we would expect students to be doing across an immersion competence phase, we would be expecting students to correctly identify and manage potential barriers to effective interprofessional communication. So you can start to see how the student learning and skills and knowledge application is started to scaffold across the curriculum against interprofessional communication. And this is what our curriculum looks like within a table. So in the first year, semester 2, we have a course, Health 1000, that all our students are enrolled in. And I'll just tell you a bit more about that before coming back to the rest of the curriculum. Health 1000, Professions, People and Healthcare, all our students in semester 2 of our first year enroll within this program. So this introduces students to the foundations of effective interprofessional practice, but also covers more broadly universal healthcare and the Australian healthcare system. And you can see that we have in 2019, approximately 1,500 students were enrolled in this program from all of these disciplines. This course, is a blended course. So there are no formal face-to-face lectures, but there are online resources in our learning management system that students log on to for self-directed learning before they attend face-to-face tutorials. These tutorials have about 25 students per tutorial, and we set it up so there are a minimum of 5 disciplines per tutorial, and then there's small group learning within that tutorial. So students are learning with, from, and about students from the other disciplines within those tutorials. And the learning outcomes that the students cover are within an exposure phase from role clarification, team functioning, interprofessional communication, client-centered care, and we also touch on interprofessional conflict management. So very much setting the foundation of our interprofessional collaborative practice curriculum. Then what we're looking to do next year in semester 2 is embed 3 modules within the program, within a course, within the student's discipline-specific program, so that students then will be timetabled to have a period of time across the faculty where they can all come together to do these modules together. And those modules are role clarification, interprofessional communication, and team functioning. And clearly, we hope the students will bring the knowledge from module 1 into the interprofessional communication. And clearly, you need an understanding of role clarification and interprofessional communication to really come together and function effectively within teams. In the third year, semester 1, they will do a further 3 modules around conflict management, and then move into interprofessional collaborative practice 1 and 2, where they're bringing together all those skills and knowledge from the first 4 modules. I hear you say, Neil, but where's client-centered care? That is embedded within all 6 of the modules. And collaborative practice then appears within modules 5 and 6. And in module 5 and 6, this is where students will be doing a lot of problem solving with case management, cases where they will be really working as teams to come up with collaborative practice management plans for those teams. And then they'll move into placement capstone learning activities, where we will set up interprofessional education learning opportunities for those students on placements. You can see here some final year placements that are interprofessional education learning experiences already happen. And this is UQ Healthy Living at Toowong, where we have an interprofessional education framework where students function in collaborative teams, where clients come along and they have health assessments and exercise programs actually developed for them that students under supervision particularly from exercise physiology and physiotherapy, then help those clients develop those learning programs and take part in them. And we also have some students from occupational therapy and social work who've been involved, and the plans to involve dietetics in the future. On the right here, you have students from Southern Queensland Rural Health who have a health and wellness clinic, where in this case we've got students learning about dietetics and the dietetics components of that program for clients who are enrolled in the clinics. This just shows you some of the mapping for the modules in terms of the learning outcomes, and you can see the first 3 modules are around exposure and immersion. Modules 4, 5 and 6 are about immersion and competence, and that's also where the interprofessional learning education opportunities for the students on their placements will arise as well. This is what our roadmap looks like for students. They come into their studies within their discipline, take Health 1000, so that exposure introduction phase, and as they travel through their program, there are touch points where they will be doing interprofessional education learning opportunities at the immersion phase, the competence phase amongst their placements, and as they emerge out into practice and completion of their studies. In parallel to this, we have our interprofessional education facilitator training program for our facilitators. There are 3 modules of 3 hours each that we're going to encourage our facilitators to actually engage and participate in. We are hoping we will also get a micro-credential for our facilitators who take part within these modules. So that's a very rushed overview for you of where we're at within our interprofessional collaborative practice curriculum. So thank you for listening, and I'm very happy to take any questions that you may have.
That was fantastic. Thank you, Neil. We do have a few questions that have come through. So I'll just get a couple of these up for you. The first one says, given social distancing restraints, how do you think that could impact introducing the curriculum next year?
Fabulous question. And with the Health 1000 program we have running this year, we're actually delivering that at the moment to the students within their tutorials as an external offering. So what this means is we have the students attending in their tutorial group in a Zoom environment. So we have the 25 students in Zoom in a classroom with a tutor, and then we divide the students up into what we call breakout rooms, where we have small groups of 5 students, and those students again from different disciplines working on the tasks, so collaborating together, and the tutor can go into each of those small breakout rooms and facilitate the students, bring them all back into the larger Zoom classroom, and again have them sharing what they found within their breakout rooms. So we already are planning to be agile within our curriculum so that we could deliver it within an external format if we needed to in semester 2 next year.
Great, thank you for that. We've got a couple of different questions which centre on a similar theme, so I'll see if I can combine them. They're both asking with respect to the Faculty of Medicine and effectively asking how much collaboration does this initiative have with the Faculty of Medicine, and also another comment mentioned it didn't seem to be on the list that you put up earlier.
Right, sure. So within the Faculty of Medicine, we have representatives on our curriculum committee, Dr. Ashley Foster, who is also involved in the first and second year of the medical training. And she's been involved in helping us design the curriculum. And we've liaised very closely with the office, with the director for the Office of Medical Education about the curriculum and the opportunities for medicine to be involved in it. So a piece of work that I didn't present today that's going on, Health 1000 is very much an undergraduate offering for students enrolled in our undergraduate programs. We also, within the Faculty of Health and Behavioural Science, have graduate entry master's students who don't enroll in Health 1000. And this is a bit like the issue for students from medicine as well, because they are a graduate entry program. So what we're developing at the moment is a Foundations in Interprofessional Collaborative Practice, which is a series of 3 modules which lift out the interprofessional education for collaborative practice components from Health 1000. And the plan is that medicine and our GEMS students, graduate entry master's students, will enroll in those modules and work together. And then both of the medicine students and the GEMS students would then be integrated into the rest of the interprofessional collaborative practice curriculum. But there is some work there still to happen about how that works for students from medicine and how that works for the graduate entry master students. But that is the approach we wish to take going forward. I actually presented something very similar to this to the Faculty of Medicine Teaching and Learning program. So Teaching and Learning Committee last week, and there's a lot of support for what we're trying to do, and clearly a lot of touch points to look at how we can make this work and include our colleagues from medicine as well.
Great, thank you. We've got a question from one of our friends in Perth, as a matter of fact, saying, do all disciplines commence their professional identity in semester 1 of first year in order to start effectively learning together? And in order to start effectively learning together for semester 2?
Yeah, so there is elements that happen within their own unidiscipline programs, and there are elements that are brought in the way that we've set up Health 1000 as well, so that part of the blended learning gets them to start to reflect on that in preparation for their learning within the tutorials. We acknowledge again that within the role clarification that we're planning for semester 2 in the second year of the program, we deliberately made the decision to start that in semester 2, the second year of the program, to make sure there was further opportunity for development of that professional identity.
Great, and we might have time for one more. We've got another one saying, thanks, Neil. Can you briefly describe how IPE and practice can be facilitated or implemented in existing services where silos are established and barriers are harder to break down?
Really good question, and we've been doing some work with our colleagues in the clinical settings around how we can help facilitate that. So there are a number of approaches that you can take. I'm working with some colleagues at the moment at Nambour Hospital, where we've been running a couple of workshops for the day, where we've very much taken an interprofessional education approach to those workshops with colleagues from different disciplines there to talk about interprofessional education and how we create interprofessional education learning opportunities actually within the workplace. And a number of and the second half of that day is actually helping our colleagues develop those interprofessional learning education opportunities. Other approaches I know our colleagues from Canada have taken, and you can do this, is there are team assessment tools that you can use that you take into the workplace, where you get your team together from the different disciplines who work in the team and actually work through how the team is working together, the processes that are there. And that actually allows you to start those conversations around the approaches that the team wants to take to collaborative practice, and then start to think about, well, can we perhaps have another workshop where we start to look at those interprofessional education approaches to start to develop that collaborative practice approach. It's not something that happens overnight. It's something that starts to evolve. So it's starting to take those small steps to make that happen. And I'm certainly involved with a number of conversations with clinical colleagues to look at how we do that. And I'm more than happy to be contacted to further those conversations with people within their own contexts and settings.
That's fantastic, Neil. Thank you very much. It's been a really interesting presentation, and based on some of the comments we've received, it seems that others have agreed. So we really appreciate you taking the time today, Neil, and also appreciate all the attendees that have come online. We hope you found this informative and entertaining. And we'll also, just to remind you, we've recorded this session and it will be sent out to you when it becomes available, which will probably be early next week. For those of you who are interested in any more of the sessions in this series, we have topics from all across the Faculty of Health and Behavioural Sciences. You'll be able to access that link from the email I send out, which will come out early next week, as I mentioned. Or also, if you wanted to go and have a look at it now, it's the HaBS Alumni webinar series. If you search for that, it should pop up. Thank you once again, Neil, and we wish you all a great day.
Thanks, everybody. Thanks for tuning in.